Joining us now from Pittsburgh to discuss this is Dr. Amesh Adalja. He is a senior scholar at the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. Good morning, doctor. Just have to say now the ball is in the court of the CDC now that the FDA has authorized the children's vaccine from Pfizer for kids 5 to 11. The CDC is likely to give it a thumbs up. What's your reaction?
This is going to be something that will be a relief to many parents of 5 to 11-year-olds whose children's lives have been on hold, whose children's lives have been held hostage by COVID-19, not necessarily seriously sickening them, but disrupting their lives in terms of virtual schooling and isolation and quarantine. And there are high-risk children that are going to benefit greatly from this vaccine. And I think we'll all benefit from having children vaccinated because the more shots that are in arms, the harder the job of the virus is to spread.
Doctor, that's kids. Now, as for adults, millions now qualify for the booster, as you know, but it can get confusing between mixing and matching and everything else. What's the urgency level for people right now who were fully vaccinated earlier this year?
Boosters aren't going to change the trajectory of the pandemic. It's first and second shots that do that. But there are high-risk groups that would really benefit from a booster, particularly those above the age of 65, those with high-risk conditions, and anyone who got the J&J vaccine. Those should be the people that are trying to schedule their boosters now. And if you got the J&J vaccine, it might be beneficial to get the Moderna or Pfizer vaccines because they have a different type of technology in them, and that mixing and matching boosts different parts of your immune system, and you might get a bigger boost than normal. So those are the people I think really need to get a booster today.
You mentioned the path of the virus. You said recently that we are now in the endemic phase of COVID. What exactly does that mean?
What it means is that COVID-19 is not a disease that can be eliminated. It can't be eradicated. It's something that's going to become one of our seasonal coronaviruses. We have 4 other coronaviruses that cause 25% of our common colds. This is on its way to that. And that means that we're going to have a baseline number of cases, hospitalizations, and deaths. But the goal is really to tame it, to remove its ability to crush hospitals. And that's what vaccines do. That's what some level of natural immunity will do. That's what monoclonal antibodies do and upcoming antivirals. All of that is going to make this a much more manageable disease. So we've got to teach people how to risk calculate and make good choices because COVID-19 is going to be with us in all of our activities. There's never going to be a COVID-0 time.
Along those lines and referencing back to the term fully vaccinated, which we've used a couple times now, with boosters, does what fully vaccinated means change?
Right now, the public health agencies like the CDC are not changing what it means to be fully vaccinated. So that's 2 weeks after your second dose of Moderna or Pfizer or 2 weeks after your single J&J dose. And I think that makes sense from an operational standpoint. But obviously, from an individual health benefit, there are people who would need to get boosters, like the immunosuppressed, like those who are elderly, those with high-risk conditions, because that's where we've seen some erosion in protection against serious disease. But I don't think it makes sense to change what the definition of fully vaccinated is because it's going to be very hard to actually implement that or to actually use that for people, for example, trying to partake in an activity. But people should stay up to date on what they require for their conditions, even if the definition doesn't change.
Okay, Dr. Amesh Adalja, as always, thank you very much.